Josh, if someone is listening, they're actually experiencing numbness or tingling right now, what would you want?
Get seen, get looked at. Well, let's find out what's going
Yeah.
on. Is this something that's been going on for a long time? Is it coming and going? That's one of the things that I hear more often than not. Oh, I'm fine now. It stopped.
Yeah.
Well, it's frequently going to come back, and so you got to get looked at. Be patient about it. Don't freak out, but make sure you get checked out.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything.
Welcome back to the Optimal Health Guide. I'm your host, Michael, and I'm here with Josh Vance, the Optimal Health Guide. Hey, Josh, how are things going for you today?
Things are going really nicely. It's been a great day.
Nice. That's good to hear. Well, today we're going to discuss a symptom that often can confuse people: numbness, tingling, pins and needles. Sometimes it comes, sometimes it goes, sometimes it's constant. Sometimes it feels harmless, but it's a warning sign. How do you know the difference? Today, Josh, I'm really hoping that you can help us understand with these symptoms, what can they mean and why nerves matter and when people should pay closer attention. So before we get to that, I do want to encourage you, if you have a question that you'd like for us to discuss, you can submit that at podcast.vancept.com. Help us to be able to direct where we're going conversation-wise for the future. I also want to encourage you, if you find these conversations helpful, please like, subscribe, and share. If you've ever experienced numbness or tingling, this episode may answer some questions you've been wondering about. All right, Josh, here we go. What commonly causes numbness and tingling?
Well, I would say most commonly it is nerve irritation of some sort. And by irritation, I mean it could be injury, but it also could just be some irritation. You may or may not actually have physiological injury to the nerve. One other common cause of numbness and tingling could be trigger points. Myofascial trigger points can cause some similar symptoms that may be perceived like numbness and tingling. But those are probably some of the most frequent causes.
Dig deeper into that trigger points. What's going on there, and maybe contrast it a little bit more? Because if it sounds like maybe the experience is the same and maybe felt the same, but what's actually different?
So with trigger points, there's a couple great books on it. In any case, what happens is an area within the muscle that stores also the calcium gets kind of stuck in this contracted state, dumps all the calcium out. That creates a contracted muscle in a way, which then causes referred pain. So it causes that pain, like we've talked about in the past,
Interesting.
in
Yeah.
different distributions based on what muscle. And there's books that kind of have mapped that out most frequently. So it can give you that referred pain. I feel kind of a burning, numbness, tingling, something like that.
Yeah.
Now, so that's the myofascial trigger points. And there's active trigger points, and there's latent trigger points. Active ones are ones that are currently creating those symptoms. Latent
Mm-hmm.
trigger points are more like maybe an area in the muscle in the upper trap here that's got that big old ball and that knot. And until you push on it, you don't really notice anything. And then once you start pushing on it, then you're feeling symptoms.
I see. Wow. Okay. I'm glad I asked that. That helps to be able to differentiate there. So why is it that nerve symptoms can often show up somewhere different than the actual problem?
All right. So that's because of the way the nervous system is built. First of all, we have a central nervous system and a peripheral nervous system. Okay. Central nervous system essentially would be your brain and your spinal cord. Peripheral nervous system are all the nerves that are coming off of the spinal cord out peripherally. They innervate arms, legs, trunk, everything else. So they give you the balance, or I should say, they give you the ability to sit and balance, as well as move your arms, legs, and have sense over various different areas of your body. Those are your peripheral nerves. That's the simple explanation.
Are there any examples that you commonly see in this area, situation where somebody is experiencing something coming from a different part?
Yeah. Okay. So often maybe looking at the neck. Okay. So we have
Mm-hmm.
a nerve root that may be irritated the neck, and we're getting some numbness and tingling outside on the outside of the hand and that thumb there. And it's causing numbness, tingling, and maybe in a severe case, some weakness in some various
Yeah.
muscles.
Wow. Okay. Yeah. So there's vast difference from neck to the hand. Okay. So that's helpful to be able to hear. When should somebody take numbness and tingling seriously?
I would say always.
That's good. It's not something we should live with.
No, definitely not. Gosh. If a person has those kinds of symptoms, the way nerves injuries usually begin is it's usually pressure. Pressure is the most common cause of nerve injury, peripheral nerves particularly. And so, if you've got something pushing on it and it's causing some numbness and tingling, it's not unusual that the symptoms come and go. They're not always constant. Sometimes we feel like, okay, it's better today, it's worse tomorrow, that up and down. Well, very frequently nerve symptoms are like that. It's not always constant. It could be, but it may not actually be a constant thing. And
Yeah.
so, if you've got those symptoms, definitely get it checked out, because the longer the pressure is on the nerve, the more likely to injure it. And then the more likely it's going to get more significant and severe as time goes on.
Let's trace that out a little bit further. So let's say somebody doesn't go seek, an evaluation. What happens if nerve problems go untreated longer?
Okay, so generally, first of all, particularly if we're talking about peripheral nerves, at first that pressure creates an injury to the outer part of the nerve called the myelin sheath. Basically, those are cells that envelop the axons of the nerve, which give it that ability for the impulse to transmit down to your muscle or other areas, okay, depending on what it's innervating. And so those get injured, and so it becomes a demyelinating injury. Now, what is the myelin? What does it do? It is like the insulation to your electrical wiring for your body. If you don't have insulation,
Yeah.
things aren't going to work like they're supposed to. Okay. So initially, it's going to tend to potentially interfere with the myelin. As that gets worse and worse, now it may start to interfere with axons. Okay, the axons are like they do the wiring. Okay, you start snipping some wires, things aren't
Wow.
going to start working very well.
Yeah.
Okay,
Yep.
so now we may have not just a myelin injury, but we may have an axonal or a combination of the two, and then that can affect whatever structure that nerve innervates. Maybe it's a nerve that gives you feeling sensation to the back of your hand. Maybe
Yeah.
it's a nerve that makes your thumbs work. Okay, just depends on where the nerve is, but generally it's going to first affect the myelin, and then it's going to affect both over time if you don't handle it.
Now, are those, situations where delaying taking action and they're getting more severe, can the nerves recover even
Well,
after a long period of time?
it depends.
Okay.
If you have a tree and you prune 90% of the branches off, that tree is very likely going to die.
Yeah.
If you only prune 10% of the branches, yeah, it'll survive. So my
Yeah.
point being is with
Mhm.
the nerve, if you have injury and only 10% of the axons are involved, and you have something done or you get treatment to take the pressure off, help it heal, yes, the outcome is very probable and good. The prognosis is not so good when we now have injury to 90% of your axons. We've only got 10% left.
Mm,
So we
yeah.
may recover. It may not be ideal,
Yeah.
and we may still have some issues.
I see. Well, let's play now the opposite direction. Let's say that maybe this conversation turns somebody in the direction to seeking help. You've got some pretty, in my words, magical tools in your tool belt. What exactly is an EMG test, and why is it helpful for somebody in a set of circumstances like this?
Okay, so an EMG test is the gold standard for peripheral nerve injuries. So what it does, it stands for electromyography. There's kind of two parts. The nerve conduction study, basically, stimulating nerves, recording off an active electrode to identify basically segments of nerves, shorter segments, sometimes longer segments. It depends on but it gives us some information. The second part is really where there's the electromyography portion, where there's very small pin with a electrode on the end. It's in the muscle, okay? And obviously nerves innervate muscle, okay? So this is going to tell us activity about the muscle and the nerves.
Wow.
And so this test is very helpful at identifying if there is, and of course, both parts have to work together. You need both parts to really have a complete idea of what's going on.
Mm-hmm.
But this test helps identify the function of the nerve. Is there an injury? Yes or no? If the
I
answer is
see.
yes, okay, well, where's the injury at? This test helps identify the location of the injury.
That's
The
amazing.
test identifies if this is a injury to the myelin or the axons or both.
Yeah.
This test helps identify severity. Is it a very mild or is it severe? And it gives us other information as well. It can tell us about chronicity. Is it a new injury? Is it an old injury? Is it somewhere between? Especially if a person's
Interesting.
had multiple nerve injuries over time and they
Yeah.
have some new symptoms, this can be helpful to clarify if there's a new problem going on or not. Okay. And then we can also see if there's actually active denervation going on in a muscle, an acute injury, not good, versus chronic injury where there's evidence of motor units that are remodeling because of reinnervation beginning to happen. Your body's trying to heal. So we can have that reinnervation going on. Okay. So very helpful. It tells us about a lot of things. It helps clarify the picture of what's going on if we do have an injury. And then that helps point to treatment. Well, what's the best kind of a treatment for this?
Yeah. That's great. Well, dig further into that. How does it actually help guide treatment on the other side? I would imagine you've got greater clarity. You're seeing things you don't normally see. What are some practical treatment, steps that you can move into then?
Okay, so first of all, it's going to identify where if there's an injury or not. If a person has symptoms, okay, I have numbness and tingling, and so let's find out: is there an injury? No, there's no injury. Okay, so maybe that's just irritated or something else is going on. Okay, so it helps to identify nerves. Okay, or maybe it does identify yes, you have an injury to your median nerve at the wrist. Very common injury, most common what we call focal neuropathy. In other words, pinched nerve in the wrist. Okay. Many people call it carpal tunnel syndrome. Okay.
I was going to say, it
Very common.
sounded like it.
So,
Yep.
right. Everybody's heard of carpal tunnel syndrome.
Mm-hmm.
And so it helps to identify that. Okay. So now we have one person that has an EMG and we see that it's very mild. It's only affecting the sensory or the myelin sheath of the sensory nerves. Okay. That's great. It's low. So the prognosis is fantastic. The treatment
Yeah.
choices are, very conservative. Okay.
Mm-hmm.
And then over here we have someone, they have a test and they have very severe. Not only does it affect the sensory nerve, in fact, there is no sensory nerve response. Okay.
Wow.
There's nothing going on there. And the motor nerve is significantly decreased in amplitude. There's not a lot. Those axons are not working very well. And they've got like atrophy in the muscle. All right. And it's very delayed, the response. Okay. So we have both an axonal injury and a myelin injury.
Mm-hmm.
They need something much more significant done, very likely surgery. Okay, so it's going to help identify where do we need to go based on this
Yeah.
kind of situation.
Wow. That's really good. I'm glad that you pointed out severe situation and less than severe situation as well. So that's super helpful to see. Can you name some symptoms that people often ignore that end up becoming really important?
Yeah, obviously the tingling, burning can be a sign of numbness,
Okay.
of,
We
of
haven't hit
nerve
on that
injury.
one. Mm-hmm.
Numbness, tingling, burning, weakness. Weakness can show up as nerve injury. It can be motor. It could be muscle stuff going on, which, muscle diseases. There's different things that cause motor weakness. Changes in strength in general, like grip in the hand, like thumb function,
Mm-hmm.
difficulty fine motor coordination and buttoning things. So, I mean, all those are pretty substantial symptoms. Sometimes other things that could be more of a substantial thing that could be like, droopiness of the eyelids or more difficult walking because of weakness in the legs, feeling like the bottom of your feet always feel like wooden blocks and not normal.
Interesting.
Maybe just kind of dull
Yeah.
sensation. Not necessarily numb and tingling, but just they don't feel normal
Yeah.
or just kind of feels, you know, some burning, numbness, tingling in my feet all the way up to my ankles and mid calf. those things, those are issues that need to be addressed.
Yeah. Are there any stories that come to mind of patients that you've worked with?
Sure. What kind of a story are you looking for?
Well, stories around this numbness, tingling. They finally come in to see you and they're getting the clarity that the EMG is providing. Yeah, I'm just looking for
Yeah.
a story that
Okay.
might help to describe some of these things you're already just speaking
Perfect.
about.
Yeah. Had an older fellow that came in. He'd fallen, injured his shoulder, I believe it was, and elbow. Okay. And had very poor use of his hand and wrist, being not able to lift it up. Okay.
Mm-hmm.
And I don't remember how long it had been, but it had been probably in the neighborhood of 6 to 8 weeks since the injury. So
Okay.
obviously he was having a hard time using his hand to do things, and function was definitely suboptimal. Grasping things, carrying things, picking things up, even like shaking a hand was a bit of an issue. So we did the nerve test and found out that he had a lesion of the radial nerve up a little bit higher in the arm above the elbow.
Mm.
So probably what happened is when he fell, he crushed it pretty
Wow.
decently.
Mm-hmm.
Okay, because we had some definite weakness in the hands. We had some numbness and tingling, but we also had a lot of weakness and loss of function. So, we were able to identify the where it was, how bad it was, and the prognosis was good,
Mm.
actually. And so we
That's great.
started therapy, and over the coming months, he was able to actually do very well and started having much, much better uh, wrist strength, and he could
Mm-hmm.
carry things, he could lift things. The
Mm.
wrist substantially improved. Another individual more recently, they had surgery, and I don't think it was anything from the surgery, but during the recovery from their surgery, which was I think in a upper extremity somewhere,
Mm-hmm.
they'd been sitting with their legs crossed for some time, and they ended up with drop foot. Okay. So we're trying to find out, well, what's the cause of this? Is it coming from the low back? Is it coming from somewhere else? And so we did the test, found out where the location was coming from. It was around the fibular head in the upper part of the lower leg
Mm.
where it had been crushed. Okay. It was kind of an interesting case because they didn't
Yeah.
have any sensory symptoms. There was absolutely perfect sensation, and their sensory responses in the EMG or the nerve conduction study were within normal limits. I didn't compare it to the other side, which I probably should have, which would have given us a little bit more clarity if there was truly any involvement. But it was normal in the normal realm.
Yeah.
But motor, we had some issues. We had some nerve injuries to the fibular nerve that gave her ability to lift her big toe, smaller toes, turn her ankle out, and particularly lift the ankle up. But the positive thing is there was reinnervation going on. So we could see, okay, things are healing. You should do very well. We just need to give it time. Let's do some strengthening exercises. And they've done very well. And the drop foots have been resolving quite nicely. Still a little bit weak, but much better.
That's great. That's really good. Well, you've hit on a few, positive outcomes from people that have experienced numbness or tingling or nerve issues. What does successful recovery from a nerve issue look like in general?
So a successful nerve injury would totally remodel. So there's a lot of factors that are going to play into that. The biggest factor is severity. If that nerve is still intact, then it can heal, albeit it may take time. So severity is a big difference. Now, the other issue is distance from the site of the lesion. Okay. And so
Okay.
what I mean is, let's say a person has a low back issue and they have compression of maybe their S1 nerve root, and it's pinched it really good, and they've got calf weakness, and maybe they've got some atrophy in their calf. Okay. They may even have to have surgery, and they have that surgery, they decompress it. Well, if we've had an axonal injury on that nerve's going to kind of die back and then have to regrow. But it grows slowly at a rate of about an inch a month.
Wow.
So if you're looking from your low back down to maybe your calf muscle,
I
that's quite
see.
a few inches. So
Yeah.
that may take years, and it may never fully recover depending on the severity of it. Okay. Now, in other cases, when we have maybe not a compressive lesion, but maybe a stretching, somewhere like a stretch injury or gunshot injury or laceration from penetrating wounds, things like that. If that nerve does not remain intact, then we may not fully recover. In fact, we may not recover much at all, depending on how well that nerve is intact. Okay, because those axons have to regrow. Well, if they miss each other,
Yeah.
okay, or you get kind of an anomalous, and this happens once in a while, where the nerve reattaches to something else, then you can get kind of some funky things.
Yeah.
And I've seen it during the training an individual that had just kind of an interesting, they had a stretch injury at birth. And so years later, every time they would breathe, you'd see their arm move because they had anomalous innervation of the phrenic nerve innervating a different muscle. So, funky things happen once in a
Yeah.
while. But point being is the severity and whether or not we have continuity of the part of the nerve. The more continuity, the better likelihood that we're going to have.
Well, Josh, if someone is listening, they're actually experiencing numbness or tingling right now, what would you want?
Get seen. Get looked at. Well, let's find out what's going on. Is this something that's been going on for a long time? Is it coming and going? That's one of the things that I hear more often than not. Oh, I'm fine now. It stopped.
Yeah.
Well, it's frequently going to come back, and so get it looked at. Be patient about it. Don't freak out, but make sure you get checked out. Pay attention to your symptoms. Where do you have them? When do you have them? Is there a particular time of the day you have them? Maybe you have them at night. Maybe you have them during the day when you're doing certain activities.
Yeah.
Those are all important components to share with your practitioner. But also, sooner better than later. If you've got that stuff going on, get it looked at sooner, because the longer you wait, the more significant it could be, and that can delay healing or make it less likely to heal and achieve less likely to get the ideal outcome that a person would really want.
That's great. Thanks again for just inserting hope into a person's situation and, of course, giving them that encouragement to be able to seek help. So those of you that are listening, we want you to realize numbness and tingling aren't just random symptoms. It's one of the ways your body's communicating that something needs to be taken a look at, to have attention given to it. If you'd like to get some understanding what's causing your symptoms, you can learn more at our website, vancept.com. You could also submit future questions. Maybe something was triggered through this conversation and you'd like to learn more. You can find that at podcast.vancept.com. Until the next time we talk, keep moving toward optimal health, friends. Thanks, everybody.